Well, originally I didn't really want to be a nurse. I wanted to be an occupational physical therapist. However, my husband was in the business program out of Cal State, and the occupational physical therapy programs are really impacted, so my counselor advised me to go into nursing because I was here anyway. I would be able to earn an income, and then it would be easier to get into the other programs, and then the rest is history because I've been a nurse ever since. I had some really great mentors who have now become friends. Kern, who's no longer with Cal State Bakersfield, went on to teach somewhere else, who was a tremendous support and mentor. Barbara Fleming. Then when I went into the master's program, Dr. Gallegos and Dr. Wildman, and that continual willingness to challenge me intellectually and philosophically, and to make sure I align my personal values and philosophy with my work and what I do for my life.
I think what makes her good at what she does is that first and foremost, she's all about kids. She's not about anything else but that. Secondly, she's about school health, and she's passionate about that. And so when you combine that heart and that passion for children and school health, that's a magical combination that's produced great results for the district.
Our families don't have cars, they don't have bus routes, they don't have money for a bus. And so to be able to get their children to a wellness center or a health clinic where they can be checked and treated for even simple things like an earache, and be in school every day healthy and ready to learn. My hope would be that they would continue to expand those wellness centers so that we serve every area, and not just in Bakersfield City School District, but that other districts would then start to do that same thing.
Well, let's start with how brilliant she is. Okay, and if you know Debbie, she is fast, she is quick, she's insightful, she's very bright, and you have to keep up. Through her ingenuity and through her creativeness and building these bridges of relationships amongst nonprofits and social service agencies, I think that's how she's created this legacy for Kern County.
We originally started the annual vision clinics as a partnership with One Sight. For me, it's this personal passion because as a child, I couldn't see and didn't know that until my school nurse did the vision screening and told my parents that I was blind as could be. And so for me, it's very personal that every child gets a chance to get their eyes examined, a full exam, because that made the difference for me from failing to being a success.
There's no way to know how many lost days of instruction we would have had from a student who wasn't able to see clearly. So the impact on that level is incredible.
Someone checked my eyes, and I need the glasses, so I got these ones. I don't know you, Debbie, but thank you for helping me see.
You'll be out in the community and someone will come up to you, 31 years in school nursing, and now these people are growing up with their children, and they come and they'll say, Nurse Debbie, do you remember me? And young people who were diabetics, that we help them learn how to control their diabetes. Or a student that I got into a dental clinic, his front teeth were all rotted, and when he saw me, he was so happy to look at my new teeth, Nurse Debbie. So there's hundreds of kids that I could tell stories about that I know have changed their lives, and hopefully for the better, and have come back as adults to find me and share that story.
She's not going to stop when she believes in something. I think the second thing that's really important too about Debbie is that her ability to partner with other people, that she looks for opportunities in relationships with others, and she's very giving of herself.
She has educated me. She has shared a lot of new information. She has shared funding sources with me, and continued to help build my confidence, and with her can-do attitude. Where there is nothing, Debbie has a vision and can make the connections.
When I took this position, she offered to have meetings with me and some of the other South Kern school nurses that were new. So she offered to meet with us and give us her guidance and her expertise.
Debbie's getting ready to retire. I don't think she can sit still. And I think as long as there's work to be done on behalf of families, she's going to find new niches and new ways of using her talents and her incredible intelligence to improve the quality of life for families in our community.
In retirement, I probably will very much continue. I have promised to be active in the foundation here at Bakersfield City School District. We have set up a special fund to help fund children who have no insurance, to help the wellness centers continue on, and I promise to help do some fundraising for that specific effort. I also do a lot of work in community organizations and through my church, doing the same kind of work, serving in the underserved population. I also spent some time working in South Kern, particularly in Lowmont, Weed Patch area. I hope to be able to help other districts set up vision clinics and travel and do some mission type work with one site. This last summer I got to go to New York to work with kids from inner city New York City, and so I plan to do some more of that. And then spend some time with my grandchildren and just travel for fun. But yeah, I can't stop doing what I'm doing. I'm not that old, you know? I am just really humbled and honored. You know, there are thousands of people who have gone to Cal State since I went there, and I got my bachelor's and my master's both there, and to be chosen and honored is very humbling and quite an honor.